Hello friend, this is my first YouTube video and the most important motto of making this video is to make easy to all the medical students to understand the topic on simple way so that you will never gonna forget during your clinical days. And today I choose a most important topic for dental student, and the topic is about mandibular nerve block, and I will try to make you understand in a simplest way. Let's get started. I had made 7 columns so that it will help you to understand and cover everything about particular mandibular block in such period of time. And each column consists of nerve, landmarks, target area, area of needle insertion, needle depth, solution, complication. The most important two mandibular nerve blocks are inferior alveolar nerve block and mental nerve block. At first, we are discussing about inferior alveolar nerve. In inferior alveolar nerve, in landmarks, it consists of coronoid notch, mucobuccal fold, anterior border of ramus of mandible, external oblique ridge, internal oblique ridge, retromoral triangle, pterygomandibular raphe, and 6 to 10 mm above the occlusal plane of the teeth. It consists of coronoid notch. It is the coronoid, the green line represent the coronoid notch. It is always present just side of the anterior border of the ramus of the mandible. And while giving the inferior alveolar nerve block, we ask patients to open wide the mouth, and then we can feel this notch with our thumb finger. And the external oblique ridge is present in external side of the ramus of the mandible, and internal oblique ridge is present in the internal side of the ramus of the mandible. And this is the anterior border of the ramus of the mandible. And the pterygomandibular raphe is present here in this area. So those are the landmarks of the inferior alveolar nerve block. And now let's us talk about targeted area. In target area, inferior alveolar nerve, as it passes downward toward the mandibular foramen before it insert into the foramen, and the target area is in here. From here, the inferior alveolar nerve is passes, and this is the mandibular foramen. From here, inferior alveolar nerve is passes, and the target area of the inferior nerve block is before the insertion of the inferior alveolar nerve in the mandibular foramen. And now we are discussing about area of needle insertion. In area of needle insertion, mucous membrane on the medial side of the mandibular ramus at intersection of two lines, one horizontal representing the height of the needle intersection and the other vertical representing the anterior posterior plane of insertion. And the area of the needle insertion is most important part of the inferior alveolar nerve block. And while inserting the needle, the bevel of the needle should always facing toward the bone. While inserting the needle, we should always pass from the opposite side of the premolar, and the height of the needle should always 6 to 10 mm of above the occlusal plane of the posterior teeth. From here, we are inserting our needle. So the vertical line represent the anterior posterior plane, and we always confused where to insert the needle in anterior posterior plane. This is the anterior posterior plane, and we are always confused where to insert the needle, here, here, or here. And for this, we should always keep in mind that this is the pterygomandibular raphe and this is the coronoid notch. Divide this area into 3 parts: 1, 2, and 3. 3 half. Divide it into 3 half, and always insert the needle in 2/3 of this area, so that we are inserting the needle from 6 to 10 mm above the posterior teeth of the opposite side of the premolar, and 2/3 of this area plane, so that we are inserting the needle here, and we will get a bone heat, and we should dispose the anesthesia slowly of 1.3 ml in solution. We have 1.3 ml of solution should be deposited in inferior alveolar nerve. In solution, 1.5 ml of solution should be passed in inferior alveolar nerve block, which is half of the 3 ml syringe, and needle depth is 20 to 25. And hematoma, trismus, and transient facial paralysis comes under the complication of inferior alveolar nerve block, while hematoma is rare, and swelling of the tissue on the middle side of the mandibular ramus after the deposition of the anesthesia. For the management of the hematoma, we should pressure and cool to the area for minimum of 3 to 5 mm. And another one is trismus. A slight degree of soreness when opening the mandible is extremely common after inferior alveolar nerve block. And another one is transient facial paralysis. It is produced by the deposition of local anesthesia into the body of the parotid gland, blocking the 7th cranial nerve. That's it for inferior alveolar nerve block. Now let us discuss about mental nerve. In mental nerve, the landmark consists of the mandibular, premolar, and mucobuccal fold. As we know that mental nerve doesn't block any tooth, but it used to block the soft tissue of the mandible, and the landmark consists of mandibular, premolar, and mucobuccal fold, and the area of the target is mental nerve as it exists in the mental foramen. The mental foramen is present here, and from here the mental nerve is passes, and in the apices of the 2 premolar there is the presence of the mental, and area of the needle insertion is mucobuccal fold at or just anterior to the mental foramen. That means from here we insert the needle, and just anterior to the mental foramen we block the mental nerve, and 5 to 6 mm needle depth should be kept, and 0.6 ml over 20 seconds the anesthesia is passes, and the most common complication of mental nerve is hematoma. That's it, guys. Thank you for watching my videos. Please comment down below if I need to correct anything, and you can also suggest me the topic you want to learn in next videos, and also don't forget to like, share, and subscribe. Thank you. Bye.